Hello, still with a retired midwife for 34 years, so we have opportunity to talk with her. All right, good morning. We'll be talking about the challenges of pregnancy. We understand that pregnancy induces a lot of hormones in our system and then affects our mental health somehow. Sometimes I see people who say that they have a lot of challenges during pregnancy. They will not go ahead and take in again. They will prefer surrogacy and the rest of it. Please, we'll be hearing from Mrs Ezeude today, 34 years experience midwife, to tell us her take when it comes to challenges of pregnancy. What are the things that actually induces those challenges, those mental stress on a pregnant woman, and how do we avoid it? So right.
To me, I can say that pregnancy is a thing of joy.
Yes, sir.
But when your spouse is not encouraging you, you start feeling so much mental stress. Okay. When your wife is pregnant and go to hospital, you sponsor her antenatally till delivery, she will be happy. But when the woman is pregnant, she'll be running for money to go to antenatal. She will be running for her feeding and all other things. She will have mental stress. But when your husband sponsored you very well, I mean, when you're going to antenatal, you'll be happy. During labor, you'll be giving money to buy things needed for your delivery. You'll be happy. So our men cause problem to women, okay, not sponsoring them very well during pregnancy and delivery. That's why mental health is a problem of some of the women.
Okay, okay, talking about that. Okay, so now we are taking that some challenges concerning relationship in our marital life, men not being able to sponsor the women financially, can actually lead to their mental health.
Yes.
Okay, now another thing I can actually ask you at this point, if apart from that money, if a man is actually providing money at all and yet the woman is still having mental stress, possibly associated to her mood at that time, maybe she don't want to conceive, what are your advice to that very woman?
My advice is I will encourage the woman. Some are delivering with CS, so when they remembered they are going in for CS, they start feeling somehow. So what I will do is to encourage them. Once your husband is taking good care of you, when you deliver up to 3, 4, you rest.
Okay. So you're saying now that we should try to be happy no matter what the issue is. The happiness on its own comes from the inside, not from outside, knowing fully well that the gift of a child is from a God, and you have no options than to be happy on it. And the next thing again I want to ask, in order to prevent that issue to occur again so that the mental health will be balanced, are you suggesting in anyhow that someone can actually go for IUD or something? That someone can actually go for possible way to actually prevent that? That's controls, family planning controls. Can someone actually do that to help the person's mental health? Is it possible?
When you agree with your husband, you don't do it alone.
Okay.
Anything you are going to do, you do it with your husband.
Okay.
When your husband accept that, you go on. But when he said no, but if it's something that will be taking your life, okay, you can meet the midwives or you meet the medical doctor. They know how to do it for you, so that it will be easy for you.
All right. Okay. All right. Okay, still with our experienced midwife. Okay, what are the advice? What again do you think can be associated to this mental health, the challenges, the mental challenge we have during pregnancy? What are the advice you can give?
So women, when they are pregnant, they start having what is called hyperemesis gravidarum. That's too much vomiting. Okay. They don't eat. Oh, yeah. When you see that person, you'll be like someone that is suffering with HIV/AIDS. Okay. So when they remember those are mental health. Some dislike their best food.
Okay.
It is the duty of the husband to help her to come back to life.
Okay. All right. So you're saying that pregnancy should be a thing of a man and a woman.
Yes.
It shouldn't be only for the woman. That alone brings mental challenge.
Yes.
Do you understand? In order to avenge it, in order to clear that issues, all those traumas that is associated to all the traumas that are associated to pregnancy, we call mental health, our mental health, we just have to do with our husbands all the time.
Yes.
Okay, what about those who get married to beating husbands, those men that drink a lot, that doesn't listen to their wife? What are the general advice you can actually give to the woman? Okay, the advice, you can go on with those advice you say that you can actually give to a woman who the husband is actually a troublesome one, that actually contribute to her pregnancy and the rest of it, but he's willing to give you that pregnancy. What are the advice you can give to
the advice I'm going to the woman, if it's my first pregnancy and my husband is not taking care of, even myself, otherwise it's not by force. I cannot die because I want to get a child. If you get to that and you're not taking care of me during pregnancy, I will say no to pregnancy and be on for me to live.
All right. Okay, that's a nice one. Okay. But what if the woman has her money and can be able to take care of herself? Because you're talking about that mental health, that challenge the woman is having at that very point. Can she continue with taking care of herself without waiting for the husband to do those?
It's individual differences. It's not what I like, you like. If you like to be taking care of yourself during pregnancy, you continue to take. But someone like myself, I cannot take. If you are not taking care of me, if I just have to, I will say it's okay. If you want me to be numbered, I will leave you and you go and get yourself with what you want.
Okay, thank you. Okay. Thank you with this information. So with the mental health, we've understood that the vomiting that we are having all the time links to mental health. Whenever you remember it, taking in, or you've seen yourself in the situation of pregnancy, it becomes a problem and weighs you down. Okay, so understand that she said that you can actually give birth to fewer children and then go out from there to maintain your stability and then increase your productivity, and so that you'll be able to be alive to train those children. Yes. With this little advice, make sure you hack into it. Make sure you subscribe to our YouTube channel. We'll be bringing you more of this. Thank you as we continue. Thanks.